I think one of the things that we could not speak about with greater clarity was the fact that COVID fibrosis, like Urmil just said, is something that has taken so much of our imagination that most of us believe that this will not regress. The strange part and the very welcoming part is we've seen significant reduction in COVID fibrosis in many patients, and there have been remarkable regression in some of them within probably a month of walking out of the ICU. Even when they walk out of the ICU, their X-rays or CT scans look pretty pathetic, though their gas exchange and oxygenation looks reasonable. Yes, they do have symptoms of something we call long COVID, where for quite some weeks after recovery, simply because the body's taken such a severe toll, like even with Ravi and Pranav, though they have good functioning lungs, the body, the mind takes a lot of time to recover from that intense trauma. To imagine that they are in an ICU setup, completely aware of everything going on around them, concerns that doctors and nurses would raise every single minute saying, oh, blood pressure is down, this is happening, that is happening. And there are no filters in an ICU. When patients are awake, it requires a tremendous deal of resolve from their part to, and I can only imagine how Mr. Ravi just broke down, towards the end of he's a very brave man, but it takes more than courage. It's an extremely tormenting experience, and we can completely empathize with what patients go through. And to see them right here, sitting in front of us, while giving credit to somebody like me, I find myself so small in this entire process, because there are a million people that have contributed to them being on this chair today, attending this webinar. There are a million people. When I say million, truly takes a village to ensure that they are well. Donor coordinators, families, the transport services, whether it be air ambulances, airline agencies. To imagine that a CRPF personnel takes special initiative to allow that organ box to travel from the door of the airport terminal to the aircraft without asking for any security check. I think that requires courage. He doesn't ask. He says that organ is vital. Pranav is getting that organ. Let's ensure that we can cut down ischemia time. There are a million people in this process. The policemen, the flight attendants, the pilots themselves, and we have routinely seen pilots cut down flight times by 10 minutes, 15 minutes, simply because they know there's an organ on board. So, it's remarkable. In what in a country like us, which is so fragmented in many ways, and when I see these political discourses, we see we are a very fragmented country. But to save one life, like Ravi's life, so many people who did not even know him came together to just make it happen. And it all began from that donor hospital and that donor coordinator who gave us that small sliver of hope. And then everyone just pounced at that opportunity, and everyone worked together. The liver teams, the kidney teams, and all of them worked together to make that 7 or 8 organ transplants happen from that one donor. I think this meeting we should summarize and probably culminate in respecting all the tremendous work that MOHAN Foundation does. And many more organizations like you, all your students, all your trainees. I think we would be nowhere without you. And I'm truly, I fill up a little bit when I say this, but I truly believe that this is a great opportunity for people like me to be involved in a science which requires so much of human material, which requires so many people to contribute to make it successful. It's not like a coronary bypass where a brilliant cardiac surgeon can do a great job and the patient gets well, is relieved of chest pain. Here, one individual, if he needs to survive, it needs an entire village to contribute. And I think that's what makes transplantation so special. And I'm only so glad to be just one solitary cog in that wheel. And thank you so much, Pallavi, for making this happen. I don't know whether we'll have an opportunity like this again too soon, but I think we must have more of these dialogues where we have survivors come and just share their stories.
Yeah.
Young coordinators can be more inspired. They feel that in the middle of the night, they can talk to grieving families with the courage that they know that Pranav and Ravi are alive today and they're living normal lives simply because of the work that they do. So let them be the motivating icons for all of us in the works that we do.
So beautifully put, Dr. Attawar.